Okay, well, good morning, everybody. Good morning, good morning. I hope you have lovely weather wherever you are. Welcome, everyone, and thank you for joining us today for the Canadian Association of Retired Persons in British Columbia flu and COVID vaccination update for fall 2023. My name is Ramona Captain, and I am the CARP BC Chief Advocacy and Communications Officer. I'll begin by acknowledging that we are gathered today on the traditional and unceded territories of our First Nations peoples. We are grateful to live, learn, play, and grow a spirit of community on these ancestral lands. Immunization saves more Canadian lives than any other form of health intervention. Joining us today is Jessica Harper, who will give us a fall update on flu and COVID-19 vaccinations so we may live better, healthier, and longer. Jessica Harper is a registered nurse with a Bachelor of Science degree. She has worked in public health nursing practice since 2006 in British Columbia. Jessica is passionate about immunization education for the public and healthcare professionals. She has spoken at provincial and national conferences in Canada on immunization, communication, and vaccine hesitancy. Jessica is a tuberculosis North educator at the BC Centre for Disease Control. Welcome, Jessica Harper.
Thanks so much, Ramona, and thank you to all of you for coming this morning and taking the time out to think and talk about vaccinations and how to help keep yourself healthy this winter. I have allotted time for questions at the end of the presentation, so you should be able to put questions into the chat, and Ramona, I believe, will be checking there so that we can hopefully address your questions after the webinar. If there are things that we don't get to, after the last webinar, I did send out a resource handout and tried to answer any outstanding questions. So if we need to, we can do that same thing as well this time. And thank you very much to CARP for inviting me and having me back. I don't know how many of you were here in June, but today we're really going to be focusing on our health this fall and winter. And really, we've talked a lot about COVID-19 and COVID-19 vaccines for the last few years, and one of the focuses that we're going to have today is on influenza or the flu. And I am joining from Vancouver City proper today, and I do want to acknowledge that I live, work, and play on the traditional, ancestral, and unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh Nation. And I'm really grateful to live in such a beautiful place with the mountains and the ocean so close to my home. I want to acknowledge that I do receive funding for public speaking related to public health education and vaccinations. I've received it from health authorities, from public health organizations, and also from pharmaceutical companies that make vaccines. I am receiving an honorarium for my time today from CARP, and some of the slides that are presented are in line with the recommendations of our provincial and national bodies, but also I may have had information provided to me from information requests from both Sanofi and from Pfizer. And as we move into today, I just want to acknowledge the work that CARP does, both around providing health education and opportunities to its members, but also the advocacy work that is done by CARP around public funding and access for older adults to access things like, for example, non-publicly funded vaccines. So today, those are just the happiest. I saw this picture. I was like, this couple is very happy to have just received their vaccines. And unfortunately, I've never seen those great colored neon vaccines as Band-Aids at our clinics before. But today, just want to start from a place of why vaccines matter, the difference between what you get for free and what you have to pay for, and how those decisions are made in British Columbia. And then we're going to talk about influenza or the flu. What is it? How does it impact us? What might we be looking at this winter here in British Columbia? And then what are our vaccine options? That old saying that an ounce of prevention is worth a pound of cure, and vaccine recommendations for those folks who are on the call who are 65 and older, and then also some learning resources that'll be at the end of my presentation, but also can be sent out after the call. Key messages today is vaccines matter. I mean, they matter all through the lifespan, but they are an important part of your health and wellness plan as older adults. In Canada, we work really hard to have a good safety net and approval and rigorous approval method for the vaccines that are offered to the public. When we think about the flu or influenza, sometimes people may think, oh, it's not a big deal, but it can actually be a very serious disease that has a lot of complications. And that's why today I want to talk about getting your flu vaccine and your COVID-19 vaccine, talking with your healthcare provider about which flu vaccine you want to get as well. And if you were with us in June, you may recognize these points, but it talks about why do we need vaccines? Really, it's to create a circle of protection around yourself and around your loved ones. Protection from some vaccines wears off over time, so you have to get it again. Sometimes there are new diseases that happen, which is something we've all lived through in the recent years, a new disease that comes out that we may be at risk for. And there's also technology and research and health science improves, so there may be new vaccines that are recommended for you. And when I used to talk about NACI, which stands for our National Advisory Committee on Immunization, before I wouldn't necessarily talk with the public about it because it may have been something that people had never heard of. But now I think for a lot of us, we're in a world where we've heard of the Public Health Agency of Canada and Health Canada and NACI and how they work together in Canada to give medical and scientific public health expertise. And what NACI does is it has a board of scientists and public health experts and immunologists and infectious disease specialists that come together. They look at all the science and the research, and they make recommendations about vaccines that are given to people in Canada. And that's why we're so fortunate in Canada to have an immunization body like that, that provides information and recommendations that we can trust. And I'm not sure how familiar people are with that there's really a difference between if I'm your nurse and you came in to talk with me individually about vaccines today versus if I'm the nurse that's planning the public health campaign in your city. So NACI make recommendations for the individual person. So for you, you're sitting there in your chair, you tell me you're 67 years old, and you tell me that you also have rheumatoid arthritis, and you're taking medication for that. Well, I'm going to make recommendations for vaccines for you based on your individual risk factors. But at a public health program level, provinces have to make decisions on which vaccines they publicly fund, at which ages, and for which health conditions. And there are other considerations that go into that. For instance, what diseases are happening where you live, or what is the budget that you have for your program. And in Canada and in British Columbia, some vaccines are not paid for by the province. So in June, we talked about some of those examples. One of those examples was the shingles vaccine. And cost can be a barrier. Some people have health coverage where they have some coverage towards vaccines, and some people may choose to pay out of pocket. And why this is important is because these vaccines have gone through all the research. They've been approved by Health Canada. Health Canada has then given NACI, our National Advisory Committee on Immunization, time to go through all the research and look at who should get the vaccine, when, and how often. And then at that point, that's where provinces and territories need to decide, are they going to pay for it through the public health budget, or will people have to pay out of pocket for it? In British Columbia, I think most people who are on this call, I'm sure, have had vaccines in the past. And publicly funded or free vaccines means that it's been paid for through the Ministry of Health. It's been sent out to the province through the BC Centre for Disease Control. And that's where vaccines are given through health units. For a lot of people last year, you would have had, and recent years, you would have had all your vaccines often in your pharmacy. And some doctors' offices or nurse practitioners may also get vaccines. And then there's vaccines that are available for purchase. So again, NACI, Health Canada's approved it, NACI has recommended it, but it hasn't been paid for by the province. So that's when we would have to pay out of pocket or through coverage that we have. And for most people, you would get that from a pharmacy. Some people, perhaps a travel clinic, if you've been traveling to different parts of the world and want to get protection against those vaccine diseases that are more common in other countries. And some doctors' offices also vaccinate, but that's not as common in British Columbia. And
Question for you.
yes.
So the question is, so for an individual consultation, do we make an appointment with our health unit?
So for an individual consultation, I would say for a conversation, your best place to start would be your physician or your nurse practitioner, if you have a nurse practitioner through primary care. If you have a new health condition or specialist or medication that you're being put on and they've told you that you need to get additional special vaccines related to that, then you would call the local health unit to make an appointment. Often, if there are specialty vaccines that are recommended for you because of current health conditions, sometimes those specialists actually fax that to your doctor and to your health unit to make a plan for the vaccines that you need. So I don't want to spend too much time on this, but just to look at, well, why aren't all vaccines free? And why does CARP do the vaccine advocacy work that they do in British Columbia for vaccines that aren't free for people who are 65 and older? Is because in the Ministry of Health, they look at what does NACI recommend, what is in the literature, what are the health conditions in the populations of our province, what is the funding that we have, and then they recommend which programs to do, and then they prioritize that along with other public health programs, vaccine programs, and other initiatives. So quickly, I just want to talk about the flu. So sometimes people will say, oh, I was so sick last week, I had the flu. But for a lot of people, the flu is kind of just a general word that covers a whole bunch of health conditions. And so when we talk about the difference between these, before COVID, this just used to be like comparing the common cold to influenza. But now we talk about looking at, well, what's a cold versus what's influenza or the flu versus what is COVID-19. And by no means am I expecting someone to recognize or identify, off the top of their head what that might be. But what I want to highlight is there is crossover between these health conditions, and also something that we've learned, I think, in the past about influenza and about COVID-19 is that they can have long-term complications. So it's not just when you're sick and feeling like, oh, I can't get out of bed. There also can be other complications that happen in your health in the interim and then in the longer term. Before we get into more of the pieces of vaccines and protecting ourselves, I do want to highlight just a baseline of something that I think we all already know and will be doing. So that's staying home when you're sick, washing your hands, and covering your cough or your sneezes. And it's something that I think a lot of us have been doing for many years, but has been a big part of the public health campaigns throughout COVID-19. And why is it so important that we reduce the burden of influenza disease, or basically how many people are getting sick with the flu in our communities? Whenever I think about the flu, I kind of think to myself what's flu got to do with it? I hope there's some Tina Turner fans on the call. But the flu actually has a lot to do with what happens for folks with doctor's visits, hospitalizations, and having issues with other health conditions that they have through the fall and winter. So if we go out and we look at vaccine preventable diseases in Canada, in folks who are 65 and older, influenza by far leads for the number of cases. Also, you'll see there's pneumococcal disease there, which is pneumonia, can cause pneumonia. And there's also shingles or herpes zoster there as well. And when I think about influenza, and when I talk about influenza, I want to think about the iceberg. So top of the iceberg is the flu is not really a big deal. Do I need to get vaccinated? I have to do it every year. Maybe I just feel sick for a few days and I'm fine. And I think the true impact is actually what's underneath. It's what we don't see above the water, and how that influenza can then lead to pneumonia. It can cause inflammation in the body that leads to heart attacks and strokes. It can cause complications with other chronic health conditions that you already have. And of course, getting sick, having to be hospitalized, having outcomes like a stroke can lead to not being able to have your life have the same rhythms and independence as you did prior to having influenza. When we go out, excuse me, when we look at Canada and our healthcare system, we don't even really have a way to capture how much influenza causes burdens on Canadians, families, older adults, and schools through the year. So we think at least 2.5 million cases, almost 200,000 emergency department visits, over 12,000 hospitalizations, and unfortunately, at least 3,500 deaths are related to people who get sick with influenza or the flu. So it is having a much more significant impact on our daily lives than we recognize. And I want to just talk about why are we really focusing on flu, and for those who are 65 and up. And that's because our immune system does change as we age, and we may not be able to fight the influenza virus with the same strength as we could when we were younger. And that means that it can cause more serious complications. And also, when we think about chronic health conditions, at least 50% of seniors 65 and up report that they have a chronic health condition. So it could be diabetes, heart disease, something to do with your lungs like COPD. And so when you get sick with influenza, it becomes that more serious. Now, it's not just for those who are over 65. If you think about it, this looks at Canadians 50 to 64, many folks through Stats Canada and a community health survey reported having at least one high-risk chronic condition. Well, then these folks are also high risk for influenza as well. And this slide is not a good news story. Basically, what it captures and it looks at through research is that when you end up having lab-confirmed influenza and you end up in the hospital, it unfortunately can be the start of real shifts in your health and your independence, and can cause issues with maybe other chronic health conditions that you were managing. And I mean, ultimately, I think we all know with our healthcare system, staffing shortages, bed shortages, we want to do anything that we can to keep ourselves healthy and well in the community, but also out of the hospital, and really not wanting to have what should be I just think you're 65 and up, you've retired, you've worked hard, you may have your family, grandkids, and you want to be able to enjoy and spend time doing those things that you're passionate about and that you love. And we really don't want vaccine preventable diseases like influenza to get in the way of that. I don't know if there's any fans of The Shining out there, as we're in October and it's kind of spooky season, but I don't know about you, but I don't want to go play with COVID and the flu. I'm not accepting that invitation. And going into this fall and winter, we don't really know, is COVID-19 going to be a seasonal disease? So like influenza, where we live in British Columbia, it comes every fall and winter. So what we're needing to learn is, well, is COVID-19 going to cause that same seasonal pattern? I just briefly want to talk about, is there things that we can know right now that might help us make our decisions for the flu season? And I just want to let you guys know that last season in British Columbia, there was a real spike, so increase in hospital visits, doctor's visits, lab confirmed influenza 7 weeks earlier than the historical average. So that meant that like last year, people were getting influenza earlier in the flu season and more people at that time. Influenza A is just one of the strains of the flu virus. Often influenza A viruses are what can cause more serious flu seasons, and a specific type of the influenza A virus, which, don't worry, you don't need to write this down, is H3N2, but that type of influenza A virus in particular tends to be more serious for older adults when we have that as the dominant flu strain that's going around. And I think a lot of you will have seen in the news, and for those of you who have your kids and grandkids, or maybe great-grandkids, there were a lot of children who were very sick last season related to COVID, RSV, and influenza. You might start to notice that there are some musical references through this presentation, but this is from the land down under. I think it came out in 81. But what can we learn from the land down under, or Australia? Their flu season happens at a different time of year than ours. So sometimes we look at the pattern of what happened in Australia to tell us what might we see in British Columbia. Unfortunately, it's not a crystal ball. It's not an exact science, but if we look at what happened in Australia this year, they had early flu and RSV activity. And so RSV is really having a significant impact on children. And again, there's that influenza A virus. So again, that's a virus that, especially when it's the H3N2, can cause more serious health complications for those who are 65 and older. And really, when we're planning for British Columbia, again, the BC Centre for Disease Control recommendations were to look at vaccinating earlier in the season and having that multi-layered approach. So get your flu vaccine and your COVID-19 vaccine, because we don't want you getting either of those diseases, and we definitely don't want you getting either of them at the same time. I also just want to talk about how you create a circle of protection for yourselves and your communities, but also for families and the children that are in your life. So if you don't have influenza and then you're spending time with grandkids, if that's part of your life, then you're also helping to create a circle of protection around them. Of course, children under 5 in particular are at risk for influenza, so we also want them to be getting vaccinated as well. So really getting to the bread and butter of what we're talking about today, we don't want to let the flu get to you, or if you did get sick with the flu, we want to reduce how serious it is or complications that could come from that. And really, the flu shot is the best tool we have right now to protect you against the flu and other complications that can happen from that. We do need to get it every year, and I'm going to explain why. We know a lot about flu vaccines. We know that we've given hundreds and millions of doses of flu vaccines over the past 50 years, and they have a good safety record. And it's much safer to get the vaccine than to get sick with the flu. Many people have no side effects, but if you do have side effects, for most people, they resolve in 1 to 2 days. And I'm also just going to hit that key point that you can't get the flu from the flu shot. And I'm going to explain why. So when we look at research and confirmed lab cases across Canada, immunization has prevented 40% of hospitalizations for those who are 65 and up due to the flu. So basically, by having the vaccine, even if you got sick, it's greatly reducing the risk that you could end up in the hospital. We're going to talk about also today with the changes in your immune system that happens as we all get older. It happens for all of us. There are specially designed vaccines for those who are 65 and up to really boost your immune system so it's strong to fight the virus. And again, just that we do need to get it every year. Maybe sometime down the road, we're going to have a flu vaccine that we don't have to get every year. But unfortunately, we're not technologically wise, we're not there yet. And I just want to say that the flu shot is just your first level of defense against the flu, in that we want to hopefully keep you from getting sick. But if you do get sick, we don't want you to get really sick or have complications with your other health conditions. We want to create that circle of protection around those that you love, and that if you're not sick, you can't pass it to them. And also, we want to reduce the risk of, for instance, someone getting COVID-19 and then their immune system being low and then them getting influenza disease on top of that. And again, I wish I had a flu vaccine. You only had to get once every 10 years, but we do have to get it every year. Part of that is because the flu vaccine, it is a smart virus, and it is changing and making little differences in itself all the time. So often we have to look at what flu viruses are going around and changing slightly what's in our vaccine so that it still matches and fights that virus. And also, your flu vaccine goes down over time. So that means you don't really have protection from the flu vaccine from last year. So we want your immune system to be strong and have lots of antibodies to be fighting if you got in contact with the virus. And I don't know if any of you have ever seen articles about how well is the flu vaccine working? Is what's in the flu vaccine, does it match with what's happening in our community in real life? How well is it going to work for me? And this is something that is very closely watched and monitored. There's researchers in British Columbia and Canada and all over the world that are looking at, hey, what's spreading in the community? And does it match with what's in the vaccine? And some flu seasons are more mild, and we don't see as many people getting sick. We don't see as many hospitalizations or people passing away. And unfortunately, other seasons are more serious, like the one that I mentioned before, which was the influenza A, and the one you don't need to memorize, H3N2. But also then there's the individual person for me. How old am I? What are the other health conditions I'm taking? What vaccines have I had in the past? How well healthy am I doing today? That does impact how well the flu vaccine works for you, which is why we have specialty vaccines for people 65 and up. And then also it looks at sometimes in how we make the vaccine, there could be a mismatch that happens. But like last year, we had a good match to what was going around in our community and what was in the vaccine. And even if they're not a perfect match, or there tends to be maybe another strain that's going around more strongly, we often have cross protection from the vaccine. So again, even though there can be differences in how well the flu vaccine is doing, it is still that first line of defense and the best option that we have as we go into fall and winter. And I think the last couple of years and probably other webinars that you've been to or talking about health, we've talked about vaccines and safety. And is it safer to get the vaccine than to get the disease? How do I know that it works? And really just wanting to reinforce that in Canada, Health Canada is not going to approve a vaccine unless it shows that it prevents the disease, that there are no serious safety concerns, and it has to work. And even after a vaccine is approved, there's ongoing monitoring that happens in every province throughout Canada and around the world to make sure that there aren't any safety concerns or issues that are happening here in Canada. And I talked about it before, like influenza vaccines for safety do have a good track record in the past 50 years that we've been using them all over the world. And I think for side effects, I just want to talk about that. Now, for some people, they get a vaccine, they don't have any side effects. For most people, they're mild and they go away within 1 to 2 days. But for some folks, it can be muscle and joint soreness, tiredness, and a headache. And there can be pain, redness, or swelling where the vaccine was given. And there's health information that this is from Immunize BC, there's HealthLink BC, and it kind of tells you, well, what to expect and look for side effects. And I do just want to say, even though this is extremely rare, if you had concerns after you got a vaccine, I do want you to call back to the healthcare provider who gave you the vaccine or call 811. And that's going to be in the resource section at the end, and you can ask to speak with a nurse. Because we really care about vaccine safety. And one, we want you to be well and healthy, but also we want to make sure that there isn't any trends or things that are happening in the community that we need to know about. So I would always, like if I was your public health nurse, I was the public health nurse in New Westminster for 5 years. So if I'd given you your flu vaccine and you called into the health unit and you said, hey, this is happening with me right now, I had a vaccine a couple days ago, do I need to tell you about it? Do I need to go see my doctor? Those sorts of pieces. And again, that's information that you can get from your healthcare provider when you get your vaccine. But I just wanted to mention that also. And can the flu vaccine give me the flu? So there's a little virus and it's getting killed with some chemicals. It reminds me of my big fat Greek wedding. He says, put some Windex on it. This is not actually Windex that they use to kill the virus though, but it's an inactivated vaccine. So what does that mean? It means that the vaccine inside of it, the flu virus is dead. So it cannot cause that flu disease. It's kind of like how ground chicken that you buy from the butcher could never lay an egg because it's just, even though it's chicken, it's not a live chicken anymore. And I want to talk about what is particularly recommended for you if you are 65 and older going into this flu season. And for those of you who are on the call and who are under 65, I also am going to talk about vaccines recommended for you. I just want to reinforce a couple of things though before we talk about it. Just that an immune system response basically means, how does your body recognize and fight if it comes in contact with a virus? And part of how it recognizes and fights inside your body is with antibodies. Now, antibodies are like a protein that's in the blood, but really what their job is for them to recognize and fight any viruses or bacteria that get into your body. So there's all different types of antibodies that do different pieces of that work, but that's really what we're hoping to do with a vaccine. We want your body to make antibodies. And antibody and antigen sound very close together, but the antigen is the foreign substance. So that's the bacteria. That's like pneumococcal bacteria. That's the virus, like flu virus. And when they get into our body, of course, they can start to grow and they can make us sick. And when that happens, we want our immune system response to bring all sorts of antibodies there to recognize and fight those antigens. And that's why we have that antigen in the vaccine, because it's a key ingredient. So your immune system, if it saw the flu vaccine, the flu virus in real life, or the COVID-19 virus in real life, we want those antibodies to recognize it, fight it, and keep growing so that your body can fight off the germ. And why I wanted to kind of talk about these things is because really we want to have our antibodies showing the flu virus who's boss in our bodies. And in British Columbia, we have different types of flu vaccines. And again, by no means do I want you to feel like you have to take notes or recognize or figure out these pieces, but I just want to say that there's a standard dose vaccine. It has this standard amount of antigens in it. It protects against 4 strains of the influenza virus. And that's the type of vaccine that most people in British Columbia will receive. Now, these other 2 vaccines, one's adjuvanted and one's high dose, and the next couple of slides are going to explain those. But basically, an adjuvanted vaccine, it has, again, that standard antigen amount in it. And then there's a high dose vaccine, which has 4 times the amount of antigen. So I'm just going to go to the next slide and talk about the Canadian Immunization Guide, which also is supported by NACI. And really, for those who are on the call who are 65 and up, you are at greater risk for more serious complications from flu. And unfortunately, as people grow older, that risk of one getting sick with flu and passing away is higher. So because of that, in Canada, for the individual person, a high dose vaccine is recommended to provide better protection than a standard dose flu vaccine if you're 65 years and older. So what vaccine you get as someone who's 65 and older, or in Quebec, 75 and older, depends on where you live. So in British Columbia, we give the high dose vaccine to folks who live in long-term care, assisted living, or who are residents of First Nations communities. For First Nations communities, it is related to communities that being rural and remote and having limited access to healthcare facilities, often in the communities where they are. And in British Columbia, so the standard dose vaccine for most folks who are 64 or under, it would be a standard dose vaccine that they would get. It's free, and that's what they would get if they go to the pharmacist for their flu vaccine. There's the Fluad vaccine, which is the adjuvanted vaccine, which again, we're going to go into more detail about. And again, that's actually publicly funded for anyone who's 65 or older who lives in their homes in community, which may be many of the people that are on this call. And then there's the high dose vaccine, which again, I explained already that who it's free for is for those who live in long-term care, assisted living facilities, and First Nations communities. And I do want to highlight here that those who are 65 and older, and you're living at your home in your community, it is recommended for you on an individual basis by NACI to have the high dose vaccine. It is just not available for free. It does have to be purchased. And adjuvanted influenza vaccine, what does that mean? Basically, an adjuvant is something that helps vaccines work better. It's an ingredient that's added to this flu vaccine to try to help create a stronger immune response in the people who've had the vaccine. And that's why it's approved for those who are 65 and up, because we really want your immune response to have a stronger creation of antibodies. And you might be like, why is there cookie batter and a cookie on this screen? Basically, so what's in the cookie batter is the components of the vaccine, including the adjuvant, but it has the same amount of antigens as a standard dose vaccine. So that's here as the one cookie. But if we go to the next slide and I talk about the high dose influenza vaccine, and it has, if we look at that cookie batter, it has 4 times more antigen than the standard dose vaccine. So why have they done that? Because it's basically giving your body 4 times more of the ingredients it needs to make a stronger immune system response. Why do we want that? Because we want to prevent people getting sick with influenza. And in research studies that have been done over the past decade, it's almost 25% more effective in preventing lab-confirmed influenza if you compare it to a standard dose vaccine. So a standard dose vaccine is what's publicly funded in British Columbia for everyone 64 and younger. And I do want to highlight here that it is safe and indeed recommended for you to go get your flu vaccine and your COVID-19 vaccine at the same time. You can get them in either arm if you like. There is a consideration there though. It does need to be 6 months from your last COVID-19 vaccine. So just look at the date of when your last COVID-19 vaccine was. Many of you will be getting a text message reminder or potentially a phone call about booking your appointments. And I just want to highlight for you, though, that when you get your text message or you register by phone to get your vaccine, that the vaccine that you are going to be offered here in BC, if you are living in community and you're 65 and older, is going to be the adjuvanted vaccine. So if I go back a couple slides, everybody don't look for a second. The adjuvanted vaccine, it's got that extra ingredient in it to try to help your immune system respond in a more strong way, but it has that standard dose amount of antigen, which is different than the high dose vaccine, which again, it is, this is 4 times more antigen. So it's got 4 times more that amount in your body so that you can have a stronger and longer lasting immune response. So if you are booking your vaccine appointments for COVID and influenza, you can book your appointments, but you would want to, if you wanted to get the high dose vaccine, then you'd want to call into the pharmacy or talk to the pharmacist when you go in, if you're in the store for another reason, and if you wanted to make that purchase for the high dose vaccine. And if you've already got an appointment booked, and say it's tomorrow, you could try to call into that pharmacy, drop in, or talk with the pharmacist about it when you go in for that vaccine. So what you're automatically going to be booked for if you're 65 and older will be the adjuvanted vaccine. And if you want to get the high dose vaccine, you do have to ask for it. And it does have a cost. So as we're coming near to the end here, I just want to go back to where we started. Vaccines do matter for you and for all of us throughout the lifespan, especially for older adults. We do have a really good safety record here in Canada and British Columbia. Like, we are very serious and committed to monitoring and making sure the vaccines that are offered and are available are safe and that they work. The flu isn't just, oh, I just kind of felt sick over the weekend. It can be serious and it can cause complications with your other health conditions, which I hope I've been able to explain to you today. I would really encourage you to talk with your healthcare provider, your nurse practitioner, your GP, or your pharmacist about what protection is right for you against influenza. I would encourage you to make your appointments to get protected against COVID-19 and influenza vaccine as soon as you can. Even if you've had your COVID-19 vaccine more recently and you're still waiting, have to wait a bit for your COVID-19 vaccine, you can book in for your flu vaccine. And it is safe to get the flu and COVID-19 vaccines together. It's going to make your life easier too. So you get both vaccines that you need at the same appointment and you're not having to go back multiple times. And Bonnie Ray, I'll leave us with something to talk about. And that is talking with your healthcare provider about which vaccines are right for you, or which non-publicly funded vaccines would be recommended for you and that you might want to consider purchasing to have that protection. And I want to encourage all of you to book your appointments for your flu vaccine and your COVID-19 vaccine. And if you're looking to purchase the high dose vaccine, to have that conversation with your pharmacist or with who you are making that appointment with. And I am very happy that we've got time for questions. I do see that there are quite a few questions that are in the chat and in the Q&A. I
Yeah,
don't
I
know.
have already made note of all of them, Jessica. So
Perfect.
if you're okay with that, I
I
can
am.
ask
Now
you.
I'm gonna stop sharing.
Okay, so I will, I've been looking at the chat and the Q&A. So first of all, thank you very much for that very informative presentation. I trust we've all learned a lot. Now, somebody did ask, will the video be available? Because that was a heck of a lot of information to take
Yes.
in. And yes, indeed, it will be available. Pardon me, I seem to have a frog. So it will be available. CARP will be sending out the link. So no worries about that. Now, the first question was somebody wanted to hear about pneumonia vaccine and also RSV. So RSV, that is not covered. I'll let you answer that, Jessica.
Yeah, so for pneumococcal vaccine, there is a vaccine that's recommended and publicly funded for everyone who's 65 and older. And there is both what's publicly funded and a pneumococcal vaccine that's available for purchase. So that is something that you could talk with your pharmacist about, and it would be important to know which vaccines you've already had. So that they can make a schedule for you. For RSV, or respiratory syncytial virus, that is something right now that there are new vaccines that are coming out for protection for infants and that's where the vaccine focus is for RSV. Right now, it's for really premature or high risk babies, but we are going to be seeing more about RSV vaccines and protection, and really the protection that we're looking at is for the young babes at this time. Yeah.
Right. Now, someone said flu and COVID, if you get them at the same time, is that hard on your liver?
For like particularly for your liver function, I can't exactly comment to that, but what the concern is just the stress and strain that it puts on your body, your immune system being able to fight it, inflammation in the body, and inflammation in the body then can affect your different body systems, but also just you feeling really sick, being in bed or being at risk and needing to go to the emergency department or into hospital because of because of how ill you are. So really that's and that's the same, just like if you got influenza and then you got pneumococcal, which causes pneumonia. Sometimes your immune system gets low, and then there's other bacteria and viruses that are like, ha ha ha, now is my opportunity, and they swoop in there as well. And that's where we really want to, where we can, reduce that risk of you getting sick with that virus and keeping your immune system up to fight off those other things that you may come in contact with.
Mm-hmm. Okay, so the next question, what do you recommend, Jessica, to boost our immune systems? Are there any recommendations?
Well, I think from like a health and wellness perspective for your immune system, I think that there's the part that you have with your healthcare providers. So recommendations, they know your blood work and your general health, your health conditions. So, taking your medications as they've been prescribed, if that's you. But there are things that just are good for all of us as human beings. So looking at how much sleep are you getting? Are you getting enough water in the day? I swear my grandma, she drinks like a teacup of water. And I feel like every time we have dinner together, I'm like pushing the water glass towards her. You know, what are the foods that you love? What's whole and nutritious, and feeding your body. And then I know that also it's hard as the days there's more darkness and things can be like slippery and wet outside or ice. So also finding ways that you can safely have activity as well and connecting with other people. Because I think we know through COVID that by not being able to connect with others, you know, that did impact a lot of us, I think, in our mental, emotional, and spiritual well-being. And I think that we have to consider those all together as a circle. And vaccines and kind of like medications and stuff is just that one corner of the pie.
Mhm. Now, somebody said they just had the regular vaccine. So
Okay.
can they also now go and get the high dose? Can they go and pay for the high dose on top of what they already have?
Unfortunately, if you've already had an influenza vaccine this season, I'm glad that you've had a vaccine. I'm glad that your immune system's already starting to have an immune response and make those antibodies to fight off viruses and germs. Unfortunately, you can't have a second flu vaccine. So it wouldn't be recommended for you to have the high dose on top of what you've already received. And for the person who left the message, I'm not sure if they're 65 or older, but if they were, they did receive the adjuvanted vaccine. And that does mean that it had that extra ingredient to try to help get more of an immune response. It doesn't work the same way as the high dose, but you are going to be getting flu protection from that.
So if you've already had the vaccine, can you get the RSV vaccine on top of that?
Yeah, so the RSV vaccination is separate from the influenza vaccine and they don't interact with one another. So it's like the COVID-19 vaccine. If you've had your COVID-19 vaccine, you can get your flu vaccine. If you've already had your flu vaccine, you can get your COVID-19 vaccine.
Also, do old COVID tests work to indicate new variants of COVID? So I have some tests in my drawer right now. I use them occasionally, but are they still good if there's a new variant of COVID?
Right now, we would recommend that you still continue to use those. That's what's in my drawer. You know, I work in a healthcare facility. So, you know, if I'm in the area where the patients are, we've got our masks on, but we're also, if we have symptoms, we're testing. I mean, down the road, there may be changes that are done to the swabs, but at this point, you know, they are still recommended to be used. Just check the expiry date, though. If they're expired, don't use them. Go into your pharmacy and you can get another one for free. There's not the shortages anymore like there used to be. You can go in ahead and get those.
Yeah, I see them all the time at both my pharmacies. Now, another question that I can answer for CARP is somebody asked, well, what is CARP doing to advocate or to get free vaccines for our older adults here in British Columbia? And I'd just like to say that we have sent a letter. Doug Jones, who is the president of the Vancouver Island chapter, plus myself and the other presidents of all the chapters in British Columbia, we have been after the Minister of Health and Premier Eby for quite a long time. We've sent letters. We did receive a final reply, but it wasn't directly from the health minister. It was from someone who works in the office saying that what they're providing now is what they're providing. They kind of skirted around the whole situation and said they're still looking into providing shingles and high-dose flu vaccines. But from the letter, it certainly doesn't look like it's on the horizon. But please be aware, everybody who is on this call, CARP will continue to advocate for you because we really believe that vaccinations are the way to go. They're the best healthcare that we can get. And of course, also, they're going to keep us out of hospitals and emergency rooms because we will be protected. And the other thing was doctors are so busy. So where else can we get information? Can we get one from a nurse somewhere? I know there's 211 that people can call. Is there any other ways to get more information, Jessica?
Sorry, get more information about.
About anything about vaccines is.
Yes. So, I mean, the 811 calling and asking to speak with the nurse. So you're going to get like a general operator and say, I'd like to speak with the nurse about vaccines. The nurses on 811 have actually had a lot of training and resources related to immunization and vaccines. You could also call through to your local health unit and ask if they have a public health nurse on call. Some areas may have that, in which then you would be able to ask vaccine questions with that nurse. But also, cold and flu season, the fall and winter, I know that it's hard to get a hold of your doctor or nurse practitioner. So those, I mean, definitely those are also good people to talk with because they know all your health history and medications and everything like that. In just recommending for which vaccines that you would consider purchasing. And I will send additional information along to you to put up to send out to members with this recording, including some further information on who to get a hold of, where, how they might find the contact information for their health unit. And I'll include some information on the RSV vaccine and recommendations for 65 and up and what it would look like for purchasing. That that's just a little outside of today's presentation, but I can send some resources along.
Oh, that's wonderful. Thank you so much, Jessica. And one other question, the final question. Where can someone find records of flu and COVID vaccine side effects? Where would you go? I mean, obviously we can Google, but that's not always the right information. There's a lot out there that isn't real.
Right. So I'll include that in the handout. So I will give, so HealthLink BC, which is that same organization you get when you call 811, they have a handout for COVID-19 vaccine and for influenza vaccines. And it'll talk with you about the side effects, what's common, what's more serious or very rare, and what to look out for. So I'll include links for that in there as well, so people can read a little bit more about the side effects.
Wonderful. And of course, the other question that just popped up is everybody wants to know cost. What does it cost?
Right. Well, the cost can vary for a general estimate. Like I believe around it's in the $50 to $75 range. I don't want to put you on the spot, Elizabeth, but I don't know if we have a general idea of like what the cost is for high dose vaccine.
I think thanks Jessica for asking. I think it depends on the pharmacy itself, but it ranges from about 75 to, I think I've seen it at 95. So it's worthwhile contacting your pharmacist and asking them what the cost is.
Right. Great. Thank you so much for that, Elizabeth. I appreciate it. And thank you for your support as well, connecting me with CARP and giving me the opportunity to connect with your membership, CARP, today. I appreciate it a lot.
My pleasure.
I've checked with a few pharmacies that I go to 3 different pharmacies and all of them had a different cost, but they were all just under $100, which for some seniors, for some older adults, it really just is way too much, and they should be free. And I promise we will continue to advocate forever to get free vaccines because other provinces do provide them free.
And I do want to encourage you that if with your current finances, you are not able to make the purchase, I do want to encourage you to still get vaccinated though. And that there is, the COVID-19 vaccines and flu vaccines, there are publicly funded options that are there. So I definitely do not want you to, getting any flu vaccine is better than not getting a flu vaccine. So please still do go in and give yourself that extra layer of protection this fall and winter.
Okay, well, thank you so much, Jessica Harper, for being with us today. And we look forward to all the links, and we will be sending that out to the CARP community. Thank you, everybody who joined us today. And we wish you good health and good wealth, and stay healthy. And thank you again for joining us.
Take care, everyone. Thank you for your questions.
That's all, folks. Bye now.